And here is the summary on the chapter on pericardial disease. First, pericardial effusion. The etiology of pericardial effusion remains unclear in many patients simply because we do not perform pericardial puncture, an analysis of the pericardial fluid, and pericardial biopsy in many patients. Possible reasons include infectious disease, malignant disease, immunologic disorders, renal failure, iatrogenic, and right heart failure. When you assess for pericardial effusion, you're looking for an echo-free space. To do that, use all views, but in particular also use a subcostal view. If you find a pericardial effusion with echo, you will describe the location. Is it localized or is it circumferential? Furthermore, you will describe the characteristics of the fluid inside. Is it clear, in other words, serose, or is it fibrinous, purulent, or hemorrhagic? Furthermore, you will quantify the size of the pericardial effusion using 2D echo, but also using measurements. Remember to always compare the pericardial effusion with previous studies. Don't forget the principle of interventricular dependence, which occurs in the setting of tamponade, but also in constriction. The typical finding here will be a septal motion towards the left, which occurs with inspiration. For tamponade, the amount of fluid plays a role, but also how quickly the pericardial effusion develops. Expect to find a septal shift, compression of chambers, and a mitral inflow signal which decreases by 30% during inspiration. In addition, look for a dilated inferior vena cava. Pericardial constriction frequently occurs after tuberculosis or other forms of bacterial pericarditis. It can also occur after radiation or post-cardiac surgery. It can be transient or subclinical. The key features are calcification and fibrosis, which is difficult to detect with echo. The physiology and echo findings are very similar to tamponade. You will also find a septal bounce, a decrease in the mitral inflow signal during inspiration, and a dilated inferior vena cava. Tissue Doppler is helpful to differentiate constrictive pericarditis from restrictive cardiomyopathy. And finally, let's turn to other pathologies that can affect the pericardium. A pericardial cyst is a benign structure which is often located in the right costophrenical angle, characterized by no flow seen with Doppler and echo. Malignant pericardial disease is often associated with pericardial effusion and has a poor prognosis. And congenital absence of the pericardium is a disease which is usually asymptomatic. Sometimes, however, strangulation occurs. It is characterized with echo by an abnormal shape of the heart, an abnormal motion of the heart, but also of the interventricular septum, and by its malposition.